Understanding sickle cell anemia. Welcome back to our channel. Today we're diving into a topic that affects millions worldwide: sickle cell anemia. Whether you're someone newly diagnosed or just curious to learn more, this video is for you. Let's get started. What is sickle cell anemia? Well, it's a genetic disorder that affects hemoglobin, the molecule in red blood cells responsible for carrying oxygen throughout the body. In individuals with sickle cell anemia, their red blood cells become rigid and sticky, taking on a crescent or sickle shape, hence the name. Occurrence of sickle cell anemia. Globally, it's estimated that millions of people are affected, particularly those of African, Mediterranean, Middle Eastern, and South Asian descent. In some regions, such as sub-Saharan Africa, the prevalence is especially high. Cause. Now let's talk about the causes. Sickle cell anemia is inherited when both parents carry the sickle cell trait. If both parents pass on the defective gene, their child will have the disease. However, it's important to note that individuals with only one copy of the gene can still carry the trait without experiencing symptoms. Signs and symptoms. Pain episodes, crises. Intense pain, often described as sharp, throbbing, or stabbing, can occur in various parts of the body. These pain episodes, also known as crises. Fatigue. Individuals with sickle cell anemia may experience fatigue or tiredness due to reduced oxygen delivery to tissues and organs. Jaundice. Yellowing of the skin and eyes, jaundice, can occur due to the breakdown of red blood cells, leading to an increase in bilirubin levels in the bloodstream. Frequent infections. Sickle cell anemia can weaken the immune system, making individuals more susceptible to infections, particularly those caused by bacteria such as pneumonia. Diagnosis. Diagnosing sickle cell anemia typically involves a combination of medical history, physical examination, and laboratory tests. The most popular methods for detecting this disease are the full count of blood cells, HB electrophoresis, and high-performance liquid chromatography, HPLC. Home remedies. Now, let's talk about home remedies. While there's no cure for sickle cell anemia, there are steps individuals can take to manage their symptoms. Staying hydrated, maintaining a healthy diet rich in fruits and vegetables, and avoiding extreme temperatures can help reduce the frequency and severity of crises. Medical treatment. When it comes to clinical treatment, there are several options available. Hydroxyurea increases fetal hemoglobin production to prevent sickle cell formation. Pain relievers manage pain during crises. Antibiotics prevent infections due to increased susceptibility. Hydration maintain fluid intake to prevent dehydration in crises. Vaccinations protect against infections like influenza and pneumococcus. Blood transfusions replace damaged red blood cells to improve oxygen levels. Bone marrow or stem transplant considered for severe cases as a potential cure. Gene therapy and other experimental treatments are also being researched. It's crucial for individuals with sickle cell disease to work closely with healthcare professionals to manage symptoms and prevent complications. Precautions for sickle cell anemic patients. Precautions for individuals with sickle cell anemia help manage the condition and prevent complications. Here are some key precautions. Stay hydrated. Drink plenty of water to prevent dehydration, which can trigger sickle cell crises. Avoid extreme temperatures. Extreme heat or cold can increase the risk of crises. Dress appropriately and avoid exposure to extreme temperatures. Manage stress. Stress can trigger sickle cell crises. Practice stress reduction techniques such as mindfulness, meditation, or yoga. Regular medical checkups. Stay up to date with medical appointments for monitoring and early detection of complications. Take medications as prescribed. Adhere to medication schedules prescribed by healthcare providers, including hydroxyurea or pain relievers, to manage symptoms effectively. Avoid high altitudes. High altitudes can reduce oxygen levels in the blood, potentially triggering crises. Avoid prolonged exposure to high altitudes if possible. When should you see a doctor? It's essential to seek medical attention if you or a loved one experience any symptoms of sickle cell anemia, such as severe pain, fever, or difficulty breathing. Early intervention can help prevent complications and improve quality of life. And that's a wrap on our guide to sickle cell anemia. Remember, knowledge is power, and by understanding this condition, we can better support those affected by it. If you found this video helpful, don't forget to like, share, and subscribe for more content. Take care, and we'll see you next time.